Founded in 1978, our vision is for Latinos, Hispanics, and other diverse populations to reach their fullest potential and achieve a healthy and fulfilled life. The Hispanic Health Council is a nationally recognized, statewide, community-based organization whose mission is to promote equity and address health disparities for Hispanics, Latinos, and other vulnerable communities through research, advocacy, and culturally resonant services.
A developing group that had started in 1972 called the Puerto Rican Health Committee. They were responding to the death of a child who had been taken by a monolingual Spanish-speaking only woman from one hospital to the next, not getting care, and finally the child died. Mostly due to a lack of understanding of both the mother's needs and a lack of understanding of her language. So that demonstrated significant deficiencies in the healthcare system with regard to the growing population of Puerto Ricans. They had yet to be fully recognized by the healthcare system. I started out meeting with Maria Borrero, who was then at the Employee Development Division of Hartford Hospital, and was pushing for the Puerto Rican Health Committee to become more active.
We're 100 plus employees that we have are all members of the community that want to give back to the community.
Advocacy, research, and training. Behavioral health. Parent and family learning. Wellness and health management. Community nutrition.
Children, we use puppet shows. They create such a great impact in children because they are the ones delivering the message.
Tenemos juegos interactivos como Yo Party Game para los niños, tenemos presentaciones de grupo para personas adultas y para personas de la tercera edad. Participamos en ferias de la salud.
Thanks to the generous support of federal, state, and local governments, plus countless foundations and individuals, all of the Hispanic Health Council's programs and services are free.
Then I became the peer support for the Supported Employment Program, the same program that had helped me through my recovery in the beginning. So Hispanic Health Council holds that special place in my heart because during the time I reached out to them, I didn't have my kids. DCF had taken my kids away from me. I had nobody. I was in a house with 3 bedrooms by myself.
Estoy bien agradecido con ellos y con el programa. Sí.
If you're depressed because the postpartum or because you need anything, you need help with anything, they will be there.
These organizations are training grounds for people who develop voice. They see where disparities and inequities exist. They become articulate about it in the research and the advocacy and the training that they do, and they go on to other things. And if they become visible, they become powerful.
My first step was to take a very close look at, what drove this organization. Take a look at the motivations around the original founders. And they believed that by embracing research that focused on social barriers to care, they could justify their advocacy, their legislative advocacy, which results in actual social change. We've embraced the notion that we're just not do-gooders, but our goal is to change the world, to create policy change, to create infrastructure change. It can be in small chunks, but at the end of the day, there's going to be some adjustment. There's going to be a change that benefits the people that really need the support.
Our vision is for Hispanics, Latinos, and other diverse populations to reach their fullest potential and achieve a healthy and fulfilled life. To that end, we will serve not only as a charity, but as a change agent through social activism. We are committed to reinvigorating our founders' original intent of conducting relevant research and advocacy, but through a current lens, and by providing evidence-based services. Although strategy, systems, research, and programs are important, we will never lose sight of those who inspire us daily, and that is the people we serve, who in some cases are in pain and have challenges we can never imagine.
The fact that it's not only one particular ethnic group, it's a diverse group, leaders from different sectors coming together just to benefit the most vulnerable. I think that makes it unique.
And when we look at ourselves 5 years from now, 10 years from now, it's going to be huge. It's going to be fantastic.
And projects come and go, and the council is here to stay.
We have to hire people right from the community, right from the neighborhoods, because if we're going to try to understand and learn from the community what the issues are and what are they really facing, and then we can figure out, so how do you address those issues?